There's a moment in your day this is already happening, and I'd bet you've never connected it to your blood pressure medication. It's the moment you swallow that pill on autopilot, coffee still brewing, something else already on your mind, and move on assuming the work is done. Here's what nobody has pointed out about that moment. The pill isn't the finish line. It's the opening of a conversation your body is now having, and depending on which of these three medications you're on, that conversation sounds completely different. The ankle heaviness, the afternoon weakness, the throat tickle that's been nagging for weeks, those aren't your age catching up, they're your body talking. And I'm saving the most critical signal for last, because it's the one people sit on for months without realizing what it means. If you've ever wished someone would just explain what's actually going on inside your body, not hand you a pamphlet, that's exactly what Doctor's Plain English is here for. Subscribe and turn on notifications. I put out one of these conversations every single week, because you deserve to understand your health, not just manage it. I'm Dr. Hannah Fields, and the pattern I see most often with patients on these three medications isn't a dramatic symptom, it's months of quiet dismissal, signals written off as stress or aging, that turn out to be entirely readable and fixable once someone explains the language. When you leave the pharmacy with Amlodipine, Losartan, or Lisinopril, the information gap isn't anyone's fault. It's a function of how much ground a short appointment has to cover. But the result is real. People attribute meaningful signals to the wrong causes and either suffer unnecessarily or make decisions about their medication without the full picture. Research on medication adherence, summarized across multiple reviews including work published in the American Journal of Medicine, consistently shows that patients who understand how their medication works, not just its name, are significantly more likely to stay on it and catch problems early. So here's what's actually happening when that pill hits your bloodstream. Picture your blood vessels as flexible pipes with muscle walls that can tighten or relax. All three medications reduce pressure inside those pipes, but through completely different valves. Amlodipine blocks the signal that tells vessel walls to squeeze. They relax, pressure drops. But when the vessels in your legs relax more than those higher up, gravity pulls fluid downward. By evening, your socks leave marks. Your shoes feel tighter than they did this morning. That's not mysterious. That's physics. Losartan works through your kidneys, blocking a hormone that tells vessels to tighten. But because it's working through that kidney system, it also shifts how your body handles potassium, the mineral that keeps your heart rhythm steady and your muscles firing correctly. Usually that balance holds fine, until something tips it. Lisinopril stops your body from producing the tightening chemical entirely. Same destination, different road. And because of exactly where it intervenes, some people develop a dry, persistent cough that can take weeks or months to appear. 3 different conversations. Once you understand yours, the signals start making sense. I think of a patient I'll call Celestine, whose story reflects a pattern I see a lot. She was 68, on Losartan, blood pressure numbers looking great on paper. But she'd started feeling weak by mid-afternoon, with occasional tingling in her hands by evening. She assumed it was stress, or retirement adjustment, or just getting older, and never mentioned it at an appointment because it didn't seem connected to anything. What she didn't know was sitting right on her kitchen counter. We'll get there in a moment. The first thing, if you're on amlodipine and your ankles swell by evening, that's your medication and gravity working together. And it matters because unmanaged discomfort is one of the most common reasons people quietly reduce their dose or stop the medication without telling anyone. Elevation helps. So does movement throughout the day, because your calf muscles act like a second pump pushing fluid back upward. If the swelling is worsening over time or comes with shortness of breath, bring it to your doctor directly. You don't have to accept uncomfortable as permanent. The second thing, and this is where Celestine comes back, both Losartan and Lisinopril cause your body to hold on to potassium. That's usually fine, until you start adding more potassium without realizing it. Salt substitutes, certain seasoning blends, electrolyte powders, many of these replace sodium with potassium chloride, and they're often labeled heart healthy. This reflects a well-established clinical pattern. One targeted conversation with a pharmacist about potassium-containing products is often all it takes to get ahead of this entirely. That was Celestine. She'd quietly switched to a potassium-based salt substitute months earlier, the one with a heart on the packaging, right next to the regular salt. The potassium in that substitute was stacking directly on top of what her Losartan was already holding on to. The weakness and tingling were her body doing the math out loud. One conversation with her pharmacist changed everything. And remember what I said at the beginning. The most critical signal, the one people sit on the longest? Here it is. If you're on Lisinopril and you've had a dry, scratchy, persistent cough, the kind that feels like something caught at the back of your throat, it's real and it's pharmacological. It can start weeks or months after your first dose, which is exactly why people miss the connection entirely. This is a well-documented response to ACE inhibitor medications. Don't suffer through it quietly, and please don't stop the medication without telling anyone. One conversation with your doctor usually leads to a straightforward fix. But here's the line that matters most in this entire video. If you ever notice swelling of your lips, tongue, or throat, or any difficulty breathing or swallowing, that is not a call your doctor situation. That is go to the emergency room right now. That's angioedema. It's rare, it moves fast, and waiting is not an option. Tell me in the comments, which of these 3 medications are you on, and did any of this match something you'd been experiencing but hadn't connected to your pill? I read every comment, and your answer shapes what I cover next. I call this the Read the Room check. 3 questions, once a week, 90 seconds. Ankles, any heaviness, sock marks, or puffiness by evening? Notice it and bring it up if it's changing. Kitchen, any salt substitutes, electrolyte powders, or new seasonings? Check the label for potassium and bring what you find to your pharmacist. Throat, any dry cough that's been lingering, any swelling anywhere in your face or mouth. A cough gets a phone call. Swelling gets the emergency room. Tonight, pause for 5 seconds when you take your medication and ask, how did my body actually feel today? This week, check your kitchen for potassium-containing products and photograph any label you're unsure about. Then send it to your pharmacist with a note about which medication you're on. If you've had a dry cough for more than a week or 2 on Lisinopril, call your doctor's office this week and name it directly. And if you ever experience swelling of your lips, tongue, or throat with any difficulty breathing, go to the emergency room immediately. That one cannot wait. Amlodipine's ankle swelling is readable and manageable, elevation, movement, and one honest conversation with your doctor. Losartan and Lisinopril shift how your body handles potassium, and your kitchen may be quietly making that harder. One label check and one pharmacist conversation is usually all it takes. A Lisinopril cough deserves to be named out loud, not endured in silence. And throat swelling is always the emergency room, every single time. Celestine stopped dismissing her signals. You now have everything she needed, and you know exactly what to do with it. Thank you for giving this your full attention today. You're leaving with something real, not just reassurance, but an actual framework for listening to your own body. Think of one person you care about who takes one of these 3 medications and share this video with them this week. Not as a warning, as something useful you want them to have. Subscribe to Doctor's Plain English and turn on notifications for a conversation like this every week. And tell me in the comments, which medication are you on, and what's the one thing from today you're going to do in the next 24 hours? My next video covers the one number on your home blood pressure monitor that most people misread entirely, and why paying too much attention to it may actually be working against your health. Make sure notifications are on. Everything I've shared today is for general informational purposes, based on real research and clinical patterns I see often. It isn't a diagnosis, and it isn't a substitute for your own doctor, who knows your specific history. Please check with your physician before making any changes to your medications, diet, or health routine.